we are in the middle of flu season as well. The main question is, how are you managing seasonal sickness and how do you approach flu shots and vaccines during this time of year? Something that's very, very important that we should all keep in consideration. With us right here live on The Splash to answer a few of those questions that are important, internal medicine specialist from Grand River Medical Associates, we have Dr. Jamie Taweel. Thank you for being here, doctor.
Thank you for having me. How are we doing today?
Doing just great, doctor. And hopefully we're all doing great health-wise, but that's why we have you here to kind of help us answer a few of these questions regarding this. Now, we're seeing flu, COVID, vaccines, flu shots, all different types of topics going around. I just want to ask you, are there any specific steps that you recommend the greater West Bloomfield community do to minimize the spread of the flu during the season?
Oh, of course. There's a lot of things that we can do to kind of minimize that risk of getting the flu, as well as any other respiratory viral illnesses. And I think that's going to, I always harp on this, but it's going to be the same as it always has been. Make sure that you are avoiding contact, you're exercising contact precautions. You're basically, covering up your coughing, you're covering up your sneezing, you are washing your hands after doing so, washing your hands between interaction with other people, maintaining a safe distance, but at the same time enjoying life. I also recommend, receiving the vaccines. Vaccines are going to be the best option to prevent the flu virus as well as other viruses for those particular vaccines. In addition to, if you do get the flu, make sure that you are staying indoors and staying away from people. And if caught in time, can get antiviral medications to really shorten the distance between the time you've had the flu to the end of symptoms, as well as make yourself a little bit less susceptible to spreading that virus to other people.
Doctor, let me tell you, you start off with some great tips, but let me tell you, to me, that seems like common sense to cover your mouth, wash your hands, common sense. But we have to reiterate these things, especially from a professional like yourself, because those are some of the key things that helps stop the spread.
Of course, common sense is common sense, but at the same time, it needs to be repeated. People need to hear this more than once. People need to kind of be reminded. We are so far, we got some distance now between us and COVID, and people are, we're breathing a bit of a sigh of relief. And all of a sudden, those precautions that we were doing are no longer really happening. And I'm not recommending everybody go out there wearing masks by any means, but still, there are some things out there that can get you.
Exactly. Great point. With that being said, I want to kind of get into the whole vaccine and flu shot situation. From your experience, how do you address concerns, hesitancies, and even misconceptions when it comes to the flu vaccine, even specifically right here in our area?
Well, education is the key, obviously. So any concerns that people have, I like to be able to try and talk them through it, see what their concerns are. People are hesitant for different reasons, and I'm not gonna berate people. I know there are some physicians out there that are frustrated, and that frustration kind of bleeds through. And believe me, I understand, and I have my frustrations. But at the same time, people want to have a little bit more of a knowledge of what's going on, and to be able to approach this in a relatively constructive way to make sure that people aren't feeling like we're just going, take this and that's all you need to do. I think it's a bad approach. So yeah, I think just basically education, reminding people flu vaccine has been around for a long time. I think a lot of the things, any type of effects that people have from the flu vaccine are typically from the proteins that the flu vaccine is created with, which is an egg-based protein. So if you have an allergy to eggs, that it can cause some allergies. Reminding people that when you do get the flu vaccine, that you are going to feel a little bit under the weather, and that's because your body's responding to the vaccines, doing what it's supposed to do to prevent the next thing from happening. But people tend to say, I got the flu shot and I ended up getting the flu that day, and it's more or less a result of the vaccine doing its thing.
Right.
As far as misconceptions, that's going to be education and a willingness to be able to have that dialogue. And bottom line, it's just making sure that people are aware, knowing that the flu vaccine, people had a lot of concerns with regards to the COVID vaccine, and that kind of bled into everything else. But you have to realize that these vaccines are different vaccines. The flu vaccine has been around for a very long time. Its process has been in place. And so hopefully, people can have a little bit more of an open mind when it comes to these things.
Great explanation right there, by the way. And I'm glad that you added all that added all of that information too to kind of clarify a few things. With us right here, live on The Splash, internal medicine specialist, Grand River Medical Associates, Dr. Jamie Taweel, talking about COVID, flu shots, and vaccines. Very important question I have for you, doctor. A lot of people, including myself, struggling with the difference between getting the flu, getting COVID, or even nowadays something as simple as a cold. Can you please just explain the difference and maybe even the similarities between these and how testing can clarify the diagnosis?
Absolutely. So that difficulty in determining the difference between those can be a bit of a problem, because I get a lot of patients that would have the flu or COVID and not get tested for it because they think, oh, it's not COVID. I had COVID before and this isn't it. Unfortunately, COVID's kind of having new different variants of itself that can present differently. The flu is kind of the flu. It tends to do what it does, but people present differently every year. So, for major differences that I would probably, viruses are viruses. They kind of hit you from all over. People tend to feel miserable from head to toe. They have fevers. It starts with a sore throat. They're achy. They're fatigued. Those things are pretty much a viral symptom. Versus something that's kind of like a pneumonia, which would only impact the lungs. I mean, you'd have the effects of having a pneumonia, you'd have fevers as well and things like that, but you'd know where that problem mainly is, or a sinus infection, it's just all up in here. Between flu and COVID, flu tends to be a little bit more quick in onset. It tends to hit you like that. COVID tends to, I might add, everybody presents differently, but tends to take a little bit more time. It's kind of more of a slow build over a day or two, as opposed to the flu where you just suddenly get hit with that. COVID still has that signature, loss of sense of smell, loss of taste. So that might be something that could cue you into COVID. The new player on the scene, so to speak, is RSV. And that's the one that's causing some significant issues with it's a respiratory thing. It's going to cause a lot of coughing. So, and we're also seeing some stuff going around where people are just having this nagging cough that's just hanging on for weeks. They feel better, but that cough ain't going away for a while. We throw everything at them and nothing's really changing. That's kind of anecdotal, what I'm starting to see a lot of. But we're now doing these rapid tests that are what they call basically a respiratory 4, and it tests for influenza A, influenza B, COVID, and RSV. So that's a one-time swab for 4 things. Most doctors are doing that. Most centers, most pharmacies are doing that, and most of those are available as well. So.
Perfect. We appreciate adding that, because you just had a light bulb go off in my head about a few things, doctor, and that's exactly why we have you here. We're a little bit pressed for time, but we appreciate all your information. Any additional information that we didn't discuss regarding flu, COVID, vaccine, RSV, or anything of that nature?
No, just do yourselves a favor and try to get the vaccine at your comfort level. I would really encourage that to get done, at least at a minimum. If you have some hesitancy, please reach out to your doctor. If you feel you're getting sick, make sure you're getting evaluated just to make sure it's not something you can give to everybody else. Please have a safe, healthy, and happy holiday.
You heard it from the doctor himself. It means so much more. Once again, internal medicine specialist, Grand River Medical Associates, Dr. Jamie Taweel. Thank you again, sir.
Have a great holiday. Thank you.